Man, woman, birth, death, infinity.
Good afternoon, and welcome to the Your Health radio and television program on the radio at AM 1240 KNRY, AMP Cable Television Channel 24, and on the web at www.ampmedia.org. Join our rotating host and their informative guests live every Monday afternoon at 4 o'clock. The purpose of the Your Health radio and television program is to help get, make, and keep listeners and viewers like you healthy. And now, ladies and gentlemen, on with the program.
Hi. Welcome to the Your Health radio and television program. I'm Dr. Hugh Stallworth. I will be your host today. Your Health is being brought to you on AM 1240 KNRY radio, on cable channel 24, and on the web at ampmedia.org. Here on Your Health, what we attempt to do is gather together experts from around Monterey County and beyond to bring issues of disease and health to you, to allow you to improve and maintain your health. Today we're going to be talking about a subject that we've talked about before on Your Health. But I thought it was so important that we really should talk about it now, and that subject is tuberculosis, better known as TB. Now, we know a lot about TB. We know that TB is an ancient disease. It goes back to 2000 BC that we know of. We know this because of dissecting ancient mummies. We have writings from ancient Babylonia, Egypt, and China talking about tuberculosis. Now, as I mentioned, we've talked about tuberculosis before, but I thought it's so important that we do it again. Why? Because we continue to see cases of tuberculosis, and we continue to see misinformation about what TB is, how to diagnose it, how to prevent it, and how to treat it. In California, TB continues to be a significant public health threat. California has the most TB cases of any state in the Union, and more multi-drug resistant cases. Just to give you an idea about how many cases we see around the world, it is the most common infectious disease that kills people around the world. The World Health Organization tells us that one person every second becomes infected with tuberculosis. Today we have invited experts to talk about this poorly understood disease and to help us understand how it affects us here on the Central Coast. My first guest is Marcy Broe, a supervising public health nurse in charge of the TB program for the Monterey County Department of Health. Marcy, welcome, and thank you for taking time out of your busy day to join us and attempt to educate us.
Thank you, Dr. Stallworth.
Now, you've been in TB for some while. You've been involved in TB investigations, in diagnosing TB, in doing what we call contact investigations, trying to see who has come in contact with the individual that has TB. You've been involved in treatment. So let's just jump right into this.
Okay.
What is tuberculosis? Help our audience try to understand that better.
Tuberculosis is a respiratory infection caused by a bacteria, Mycobacterium tuberculosis, hence its name, and it is spread usually through the air from a person with active disease, active tuberculosis, to anyone who has close contact to that person with the disease. And as I mentioned, it's spread in the air. So if someone has the disease, they can cough, sneeze, they have the bacteria in their sneeze and the droplets that come in the cough or the sneeze through the air, and someone breathes it in and can be infected with tuberculosis.
So we know it's a bacteria, not a virus, but a bacteria.
A bacteria.
Now, can TB be pretty serious?
Yes.
Even nowadays, with all the medications we have, we don't hear about a lot of people dying, but can it still be pretty serious?
Tuberculosis, TB, can be very serious, especially if it is ignored or not treated in sufficient time and treated adequately or correctly.
I see. Now, what are some of the symptoms that people might notice if they are infected with the TB bacteria?
Symptoms can vary from very severe symptoms to mild symptoms, but routinely you'll hear that somebody is coughing or having a productive cough, complaining of a lot of phlegm or a cough that persists over many weeks. Other symptoms could include fever, a high fever, 100 degrees or higher, weight loss, shortness of breath, night sweats, just complaining about breathing problems or just not feeling well. It could include one or all of those symptoms. It doesn't have to be all of those symptoms, but it can be more than one.
I see. Now, unlike a sore throat, a strep throat, or a cold, or the flu, TB is not something that just comes on real quick. These symptoms can progressively get worse and come on over weeks, if not months. Is that a pretty fair statement?
Yes, that is a fair statement. And you bring up a point. The sooner that you can get in for medical care, the better you can get treated and also stop the progression of the disease to a more serious form of the disease.
Okay, so if there's one message we want to get to our audience, it is the sooner we can get to someone with TB and begin to treat them, the sooner and the more likely they will not suffer any serious consequences of the infection.
That's correct. And just to make a point of that is that if they continue to have the cough or the disease over a period of time, they will become weaker, not able to work. Their lungs can be quite deteriorated, so it will change the length of treatment and the kind of treatment or medications they may need.
I see. Now, most people believe that tuberculosis, or TB as we tend to call it, just infects their lungs, just infects people's lungs. What about that? Is that the only place that tuberculosis can reside and cause symptoms, or are there other parts of the body that the TB bacteria can infect?
TB can infect other parts of the body, and we get referrals throughout the year for patients with tuberculosis in other organs. For example, they might have TB of their kidneys, TB of their spine, TB of the skin. So no matter where the TB is located and diagnosed, we at the health department do follow those patients and make sure that they receive adequate medical care. Now, I do want to point out, though, that our primary concern for infectious disease would be TB of the lungs or in the respiratory tract.
Because it's easier to spread that from one person to another when it is in the lungs. That's what we really worry about.
Right, and that then would increase our need for protecting the community and for doing, as you had talked about, contact investigations.
Okay. Now, I mentioned when I was introducing tuberculosis that it's very prevalent around the world, especially in developing countries. Every second of each day, someone in the world is being infected with TB. And in California, we have the more cases than any other state. What about here on the Central Coast? What's the prevalence? What number of cases do we tend to see here?
Fortunately, in Monterey County, we're considered a low incident county. We do not have a lot of cases, but sometimes the cases require extensive case management and follow-up, because we want to make sure, again, that they receive follow-up throughout their medical treatment. And if that takes 6 months, 9 months, 2 years, our case managers follow them for that period of time, as well as their contacts. So in Monterey County, our statistics are low, our numbers are low compared to other counties in California, but they still require ongoing case management and follow-up.
So on average, about how many active cases of TB would we expect to see in Monterey, well, at the health department?
Last year, in 2009, we had 16 cases diagnosed in Monterey County. We followed approximately 20 to 25. So on the average, we usually will have at least 25 cases that are requiring case management. That includes cases that may have moved in from other counties, other countries, or who need just a post-treatment follow-up here in Monterey County.
Okay, now, our listeners, as they hear, oh, just 25, that's not much. But in public health, at the health department, we follow each one of those cases, each one of those clients, patients. You and your nurses, you make sure that they take all their medication when they're supposed to take it. We interview and test people that may have come in contact with them. So it is, and those 25 patients are quite involved in terms of securing or making sure that everyone else in Monterey County is healthy.
Exactly. The number 25 doesn't seem significant, but when you look at one of those cases may have had numerous contacts, and we're trying to prevent the spread of the disease to one of those contacts, especially if they're a child, it may require extensive work and follow-up and testing. A case, especially if they're a drug-resistant case, may have hundreds of contacts. Wow. And we may need to follow them and test them and make sure that they have not been infected with the tuberculosis bacterium.
It sounds like your staff stays busy with tuberculosis.
Yes, they do.
Talk to us, if you will, about what services that the Monterey County Health Department offers as it relates to tuberculosis.
There are numerous services. As far as my staff, we work primarily with case management of suspects and cases. And so they may need to be working with that case to determine what their medication needs are, if they can afford to pay for the medications. In every local health jurisdiction can determine how to follow cases. In our county, we follow them very closely to make sure that they're taking their medication correctly and daily. We provide directly observed therapy, so we go out and watch them take their medications Monday through Friday, because we do, again, want to prevent drug resistance, and we want to ensure that the patient gets adequate treatment. They do the contact investigations. When I say they, meaning my staff, they're very busy. They need to go out and identify who the close contacts are and then provide testing to make sure that they've not been infected with the disease. If they have been infected, then we also offer or refer them for latent TB infection prophylaxis or treatment. Okay. So just a few things that they get busy in, and testing. They themselves do the testing.
Okay. And we'll be talking about testing a little bit later in the program, but can people in the county call with questions? Just concerns, just so they can learn more about tuberculosis?
Yes, we're always available to answer any questions. And it may not be that I would be able to provide the service because, as I mentioned, case management of suspects and cases is the program that I work with directly, but I always will connect them with the appropriate resource, whether it's a positive skin test or a question about an abnormal x-ray or employee testing. They please can call me and I can answer their question or redirect them to the appropriate person.
Good, good. Now, you mentioned treatment. Now, anyone that knows anything, knows a person that's had TB or has had TB themselves, knows that the treatment is pretty involved. Tell us a bit about how long people can expect the treatment for tuberculosis to last.
Our TB controller, Dr. Richard Tezak, looks closely at the history that the patient presents, looks at the x-ray findings, and also at the bacteriology that we collect. And after looking at all of that information, makes a medical decision as to how long someone needs to be treated. Normally, routinely, it might be 6 months of treatment.
Okay.
If there's any other factors that require longer treatment, it may be 9 months to 1 year. It also depends on the site of the tuberculosis. For example, central nervous system or spinal tuberculosis would be a longer course of treatment.
Now, that's a long time.
It is.
It's hard for most people to get through that 7 to 10 day course of penicillin for a strep throat. But you're talking different medications, several different medications, for up to a year if it becomes necessary. That's a long time. Now, I want to emphasize one thing that you and your nurses do, and that is directly observed therapy. Talk about that for a moment, because it's so critical to getting people well and preventing drug-resistant cases of tuberculosis. Tell us about that directly observed therapy that you're involved in.
Directly observed therapy is just as it states. We have our staff, usually initially it's the nurses who go out and start them on their medication, but we also have community service aides who go out on a daily basis, Monday through Friday, and observe the patient taking their medication. The time frame, we try to make it a time that's convenient for them, but also make the patients aware that we're observing patients throughout Monterey County, from the northern border near Pajaro, near Santa Cruz County, all the way down to San Ardo and all the way down to San Luis Obispo County. So the timing is important so that it's a good time for the patient, but also a good time for our outreach workers. The directly observed therapy is each patient has their own medication, and so we want to make sure that they're taking the appropriate medication at the appropriate time every day so that they get adequate treatment.
And that is so important. We found that over the years that people stop taking their medication. A year is a long time. 9 months, 6 months is a long time. And we're talking several medications a day, and sometimes you don't feel that good after you take them.
Right.
But your nurses are on top of it and make sure that people take their medication, and I applaud you for that, for the job that you're doing for this.
The staff is very dedicated. I'd like to also mention the directly observed therapy also allows us an opportunity to do ongoing assessments. If a patient complains of any side effects, if there's any change in their life, it could be a psychosocial need, a financial need, a housing need. This is a wonderful opportunity for them to work closely with their nurse case manager and with their outreach worker. And so it's another way to help to case manage them properly.
Okay. Marcy Broe, I want to thank you for joining us today. Don't go too far, because we're going to have you on at a later segment. We're going to take a short break now. We've been talking to Marcy Broe, supervising public health nurse in charge of the tuberculosis program of the Monterey County Health Department. We are going to take that break. It's necessary to do it. Don't touch that dial. We'll be right back.